are the most urgent realities that the NHI bill fails to acknowledge?
Well, what it does is it does effectively nationalise health. So what is happening is, in terms of Section 2 and Section 33 of the bill, it sets up the Minister of Health and certainly the government to make all the healthcare choices for individuals in the country. And so the first big issue is the fact that it removes the constitutionality of choice. The second issue is the additional issue where it makes sure that the government makes the choice for everybody and is the single payer, meaning that medical schemes are effectively less of an issue and are effectively outlawed in terms of the role that they play going forward. And so it actually jeopardizes the way that we attract and hold our current healthcare workers as well. So whether it's nurses or doctors or specialists, these are resources that globally are very well sought after. And I've heard the minister talk about that this is fear-mongering. In fact, it's not. We know in the US, in Canada, and the UK, they're looking for together over 300,000 workers to join the developed countries. And so we must realize that we need to do everything in terms of how we construct health, whether it is through a universal health care program or project or reform. We need to make sure that we retain these valuable resources, otherwise we start at a deficit. And in addition to the resource conversation is obviously the conversation on how do we actually finance universal access, or how do we finance the NHI Act. And that part of it didn't come through the budget speech. It certainly hasn't been clear on where we are to find 500 billion, anywhere some estimates go up to 1.3 trillion rand per year.